Good morning, everyone, and thank you for coming at such short notice. Since the beginning of the outbreak of the coronavirus, we here in San Francisco have done everything we can starting back in January to prepare. In fact, we operated immediately our Emergency Operations Center in order to maintain clear information from around the country and around the world to understand what was happening and to try and make sure that we were providing the public with the best information that we had to be fully transparent, but also using the data and the science to ensure that what was being communicated was entirely accurate. And as a result of that work since January, in February, just February 25th, we declared a public state of emergency here in San Francisco so that we can further prepare for the possible arrival of the coronavirus here in San Francisco. And as I said, through this process, it has been all about protecting public health and making sure that we were doing everything we can to communicate accurate information with what we know. Sometimes a lot of information gets out there. It's not entirely true, but it's important that everything that we know is communicated directly to the public so that we have accurate information every step of the way. Today, we are announcing the first 2 cases of coronavirus in our city. They've been detected here in San Francisco, and these individuals are contained. And I will let Dr. Colfax talk a little bit more about the details. And I want to be clear that we have been planning this for weeks. And so we are prepared as a city. We want people to continue to do exactly what we've asked people to do, and that is make sure that you're washing your hands and that you're doing the things that are going to help to protect yourselves in the midst of what we know could continue to be a virus that spreads. And so at this time, I'd like to ask Dr. Grant Colfax to come up and provide the details of the 2 cases that were just diagnosed.
Good morning. I'm Grant Colfax, Director of Health, and thank you, Mayor. The San Francisco Department of Health lab conducted COVID-19 tests for 2 patients and have recently found that 2 patients are infected. These results were reported to me this morning. The 2 patients are unrelated, and both are being cared for at separate hospitals in San Francisco. The patients do not have a history of travel to a location with confirmed COVID-19 cases and have no known contact with a person with a confirmed COVID-19 case. These cases are like similar cases we are seeing in the region. They are indicative of community transmission of COVID-19. The patients are in fair and serious condition and are being treated in isolation at the 2 different San Francisco hospitals. All appropriate precautions for the patient, visitors, and hospital staff are being taken. The health department has informed the patient's families this morning and is investigating the patient's history and contacts to protect the health of individuals and to help slow the spread of the virus in the community. Patient number 1 is a man in his 90s, and he is hospitalized in serious condition. The patient has underlying health conditions. He was tested by the DPH lab, and the results were given to me this morning. Patient number 2 is a woman in her 40s, and she is hospitalized in fair condition. Again, her results were provided to me this morning. To protect privacy, San Francisco will not be releasing further patient information or identifying the hospitals in which the patients are being treated. Unfortunately, these cases of COVID-19 in San Francisco residents do not come as a surprise. Given the virus has been detected in the Bay Area, California, and increasingly across the country, San Francisco has been preparing for the appearance of COVID-19 in the community for many weeks. Last week, the city declared a local emergency to boost our preparedness in anticipation of just this situation. The people who are sick are getting the best care provided by our outstanding healthcare professionals. We do not know at this point how they were exposed to the virus, which again suggests it is spreading in the community. We expected that to happen, we anticipated that, and are further investigating the circumstances of these patients' exposure. Let me be very clear. This virus does not discriminate. Stigma and discrimination is unacceptable in this time when we need to come together as a community to protect public health. All of us need to do our part. Do the basic things. Wash your hands with soap and water for 20 seconds. Cheap soap is just as good as expensive soap. If you do not have availability of a sink or soap, use hand sanitizer. Please do not come to work or go to school if you are sick. Stay at home, and if necessary, contact your healthcare provider. Ensure that when you greet people, you can do an elbow bump. Do not shake hands at this time. That is public health data that shows that that reduces the risk of transmission. I also want to stress that due to the fact that we started local testing in San Francisco on Monday at our public health lab, we are testing more people. We now have availability of test kits to test those at most risk for disease. There is no on-demand testing in San Francisco at this time, and people who have questions about their symptoms and whether they should be potentially tested should consult with their healthcare provider. Additional information from the health department is available on our website at sfdph, that's sfdph.org. Thank you.